This is Helena at Large. I'm Helena Strauss, and today I'm going to tell you why you need a myeloma specialist if you have been diagnosed with multiple myeloma. As usual, these are my views as a myeloma patient. They are not substitutes for professional medical advice, diagnosis, or treatment. Always seek the counsel of a qualified healthcare provider regarding your condition. So, the first reason you want a myeloma specialist to treat you is that multiple myeloma is a rare cancer. Your average oncologist sees 14 times as many cases of breast cancer and lung cancer as they do of multiple myeloma. And if you're thinking, no problem, I'm not seeing a general oncologist, I'm seeing a hematologist. Well, even among the blood cancers, myeloma is a bit rare. There are almost twice as many leukemias and almost 3 times as many lymphomas diagnosed every year compared to myeloma. The second reason you should see a specialist is that every case of myeloma exhibits a combination of variables. One variable is the chain involved. Is your myeloma kappa or lambda? Another variable is the particular immunoglobulin involved, of which there are 5. And then there's your genomic profile, which is actually a combination of variables. You will hear these referred to as your FISH results. These are the particular chromosomal deletions and translocations of your myeloma that are obtained when they biopsy your bone marrow. All these variables come together, your chain, your immunoglobulin, and your FISH results, to help a specialist assess your risk and prognosis and direct your selection of therapies. A general oncologist just isn't likely to know how to use all this information to your best advantage and to tailor a treatment or a series of treatments to give you the best outcome and quality of life. The last reason you should seek out a myeloma specialist is that there are a lot of new treatments that have recently been approved and more coming down the pipeline all the time. A specialist will know best how these newer treatments apply to you. When I was diagnosed in 2021, I was told now is the best time ever to be diagnosed with a blood cancer. Treatments have progressed so much that just since 2014, the number of people living with multiple myeloma has doubled. Finally, bringing a myeloma specialist on board does not necessarily mean you jettison your local oncologist or have to travel hours every time you have an appointment. My specialist is 60 miles away, and I started treatment with him by sending my medical records and having telehealth visits. He prescribed tests and scans that I hadn't already had, and he then designed my initial treatments, which are called induction therapy. I then received treatment from my local oncologist, who's only 15 minutes away. It is important, however, that you check with your insurer to make sure the telehealth visits are covered. I know it's a bit daunting to have to search out another doctor when you might not be feeling well and are dealing with the emotional impact of diagnosis. Try to think of it this way for a moment. 5-year survival is a solid 85%. So you are going to be working with your medical team for some time to come. Now's the time to assemble the best. These first 4 to 6 months of myeloma are probably the most challenging in terms of learning about what you have and how you're going to live with it. There's a whole lot of specialized lingo with myeloma. You will learn it. For now, just take it one day at a time. And if you can't do that, take it 1 hour at a time. I'm Helena Strauss.